Good afternoon and welcome to the December 23rd Community Update. My name is Stacy Wood and I'm the Public Information Officer here at Buncombe County Health and Human Services. Our speakers today include Stacy Saunders, Buncombe County Public Health Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, Esther Mannheimer, Mayor of Asheville, Fletcher Tove, Public Health Preparedness Director for Buncombe County Health and Human Services. As a reminder, the Spanish version of this update can be found on the Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. And all of our community updates can be found on the Buncombe County YouTube channel. And so now we'll go ahead and get started with an update from Stacy Saunders.
Good afternoon. I am sure many of you are winding down your day and eager to move into holiday mode. So thank you for choosing to spend some time with us today for this important message. Our cumulative COVID-19 case count is currently 8,220. In our community, we have lost 143 of our own neighbors related to COVID-19. Our average cases per day continue to grow, and we are adding about 135 new cases on average to our local count. Additionally, our percent positivity has climbed over 5% in the last 4 weeks. Around November 23rd, our percent positivity was 4.7. We now have a percent positivity of 8.3. This, coupled with our growing new cases per 100,000 per week, is indicative of substantial and increased community transmission. As a result, our county has now been designated orange in the state's county alert system. Our state has reached over 494,000 identified cases of COVID-19 cumulatively, and we are adding record numbers of new cases in the last few days. Our local hospitals have seen an increase in daily inpatient numbers associated with COVID-19. Mission Hospital System is currently reporting over 100 inpatient COVID-19 patients on average each day. Testing in our community continues to be high. We are seeing an average of 8,000 tests completed each week. This is extraordinary, and we are grateful to all the staff and partners who are making this happen throughout our community. We have to reduce the spread of COVID-19 and blunt the impact to our healthcare system. Our efforts are needed now to turn these trends around. We face sustained, if not a significant increase in cases in the coming days if we do nothing. No doubt you have started to think about your holiday plans. We do not recommend travel to be with folks outside of your household. If you are celebrating with only your household, thank you for choosing to limit your interactions with others. If you are choosing to celebrate with others outside your household, either in your homes or others' homes, please remember to wear a mask, keep your distance, and wash your hands. Even if these are family members and close friends, wear your mask, keep 6 feet apart. If you got a COVID test prior to your gathering, even if your test is negative, use a mask and stay 6 feet apart. Thanksgiving showed us that folks gathering with others outside of their household did not practice the 3 W's and let their guard down. Please remember, wearing a mask, keeping distance, and washing your hands matter. They do reduce the spread and help protect you and others from exposure to COVID-19. Please consider other ways to express fellowship and joy with friends and family instead of traditional gatherings. We have seen and continue to see that when people are in environments where they are in close proximity of one another without wearing a mask, we see exposure and spread. Please do not put yourself or others at risk. Stay within your household, limit your interactions with others. If you are sick, stay home. These simple and easy measures are so important to stop the spread as we roll out vaccine. Immunizations will be rolled out using the North Carolina Department of Health and Human Services prioritization framework. Buncombe County Health and Human Services, with our partners at Emergency Services and others, began rolling out vaccine on December 22nd. On our first day, we immunized 150 individuals, mostly medical first responders. This was a momentous day, and we are excited to be moving vaccine into our community. Fletcher and I just came from working our day 2 vaccine site, where we are currently vaccinating other medical first responders and others involved in testing and vaccine efforts. In the coming days, we will be moving through our 1A provider groups and getting more and more of our healthcare workers who are critical to care and support of COVID-19 patients. And as vaccine supply increases, we will continue to move through the Department of Health and Human Services phases of administration, working our way to community distribution. Vaccine arrival is a wonderful event, but until vaccine supply can support immunizations for everyone in our community, consider your neighbors, your family, and your own health. Please give each other the gift of health this holiday. Wear a mask, wait 6 feet, wash your hands. Stay within your household for the holidays to slow the spread. Our key takeaways: trends are not improving. Celebrate the holidays within your household. And please remember that if you did get tested before the holidays, a negative test is not a guarantee. Please continue to use the 3 W's. These are not easy times, but this is very important and a pivotal moment in our history where we can all say that we pitched in when it mattered the most to slow this pandemic. Take care of yourself and others. Be patient with yourself and others. Know that public health and our healthcare providers and healthcare workers will be working nonstop over the holidays to care for our community. And we need your help to do this, for you and for your loved ones. We need everyone, one Buncombe, working together. And now I welcome Board Chair Brownie Newman, who will outline local restrictions for Buncombe County.
Good afternoon. My name is Brownie Newman. I serve as the chairman of the Buncombe County Commission. This afternoon, in coordination with Esther Mannheimer, the mayor of the City of Asheville, I will be issuing an updated local order to mitigate the spread of COVID-19 in Buncombe County. Over the last month, we have been alarmed to watch the steep rise in not only the number of cases of COVID-19 in Buncombe County, but the rapid rise in the number of people becoming so sick from COVID-19 that they require hospitalization. As was mentioned just 30 days ago, the number of COVID patients in hospitals within the 18 counties of Western North Carolina was just 81 people. Today, it's over 200 people. At Mission Hospital, the percentage of inpatient beds that were occupied with patients sick from COVID-19 30 days ago was 3.9%. Today, it is almost 10%. And the number of ICU beds occupied by COVID patients has grown from 11% to 21%. Throughout most of our experience with COVID-19 in Buncombe County, the rate of positive cases in our community has remained below 5%, which is where our health experts want it to be. But for the past several weeks, the rate of positive cases has grown to more than 8%, confirming a broad increase in COVID spread within our community. We appreciate the work so many people are doing, including members of the business community, to keep people as safe as possible Recent field surveys by county officials has shown that the vast majority of individuals and businesses are utilizing masks for people when they are indoors. This is making an important difference. The number of cases of COVID would be far greater in Buncombe County without everyone's active support. Unfortunately, in spite of these strong efforts, COVID is spreading rapidly. I've spoken with multiple people who serve as doctors and nurses at Mission Hospital in the past week. These health professionals are already stretched very thin. Each person I spoke with expressed genuine concern that the hospital could be overwhelmed in the coming weeks if the number of COVID cases continues to grow. Capacity at the hospital is not just determined by the amount of physical space in the buildings, but also by the number of trained nurses and doctors available to care for the sick. We are facing the possibility that people who become sick from COVID or another illness or injury who are taken to Mission Hospital will not be able to receive quality care because the number of sick COVID patients overwhelms the system. It's critical that we avoid that situation. The two provisions adopted today are intended to reduce the situations where people gather in close proximity within crowded indoor environments, and where wearing a protective face mask or face covering is either impossible or often not used. First, we are going to lower the capacity allowed for indoor dining from 50% to 30%. I want to emphasize that this change is not the result of members of the restaurant community not taking COVID seriously or doing what they can to keep their customers and staff safe. The vast majority have worked tirelessly to do this. The unfortunate reality is that people must take off their masks in order to eat a meal. Having people from different households sitting around a table together indoors, just a few feet from one another, for 30 minutes or an hour or longer without masks is the perfect environment for the spread of COVID-19. CDC research determined that people who became positive for COVID were twice as likely to have eaten a meal within a restaurant within the previous 2 weeks compared to people who had avoided being infected by COVID. Recent research also indicates that a person with COVID is not only highly likely to infect other persons sitting at the same table as them, but can also transmit COVID to numerous other people within the restaurant, even if the other people are seated at tables more than 6 feet away. Based on the ventilation within the building, COVID is primarily an airborne transmitted illness. It is fair to ask, why the additional focus on indoor dining? Currently, there are not other business environments where it's permissible for people to congregate without wearing masks for long periods of time. There's scientific research that indicates that lowering the capacity of indoor restaurant seating to 30% or less can lead to a reduction in transmission of COVID in this specific environment. Our action today does not change any policies related to outdoor dining, which is considered far safer than indoor dining. The other policy change today is to reduce the number of people from different households that may gather for social activities indoors from 10 persons to 2 persons. Our health officials believe that these indoor gatherings of people from different households is a significant driver in the growth of COVID illness in Buncombe County. In order to allow individuals, families, and businesses time to prepare, these policies will go into effect on January 2nd. I'd like to close by saying that the adoption of these policies is something we do only with real regret. This has been a terrible year for many of our locally owned businesses and the workers in our community. Adding to these hardships is the last thing we want to do, and we recognize that these policies do create real hardships for many. We are hopeful that over the next several months, the widespread distribution of safe and effective vaccines will end the COVID-19 pandemic. However, during the next 2 months, we could see the greatest amount of sickness and deaths from COVID as we have through our entire experience so far. Thank you. I would like to now introduce Asheville Mayor Esther Mannheimer to share some remarks.
Thank you, Chairman Newman and County Commissioners, for leading in the effort to address the growing number of COVID-19 cases in Buncombe County and across the state. As many of you know, yesterday, Governor Cooper announced that more than 90% of North Carolina's counties are now designated red or orange. This means that there is significant or critical community spread of COVID-19. At this moment, the city supports the county's decision to move to more stringent restrictions beginning on January 2nd. We do this in full partnership with the county. These restrictions will be more restrictive than the governor's order. Although these restrictions will begin after the holidays, until that time, I urge you to use extreme caution during the holidays by continuing to follow the governor's order and eliminating plans to gather indoors with those that live outside your home. Stay home and connect with family and friends outside your household virtually or by phone. If you do gather in person, keep it small and do so outside. Get a COVID-19 test before you go. Keep 6 feet of social distancing and follow the modified stay-at-home order and be home by 10 p.m. And as always, wear a mask. I know this is really hard. In so many ways, this has been a year like no other. And the way we are celebrating the holidays is also very different. My family and I will follow the guidelines by spending time together outside. We've had to move our gathering time around the weather because it looks like it's going to be really cold on Christmas. I'll not be able to be with my brother and his family and their newborn baby, who I haven't seen since he was born in August. And I won't be able to see my sister. In fact, I haven't seen my siblings in person since before the pandemic. My sister-in-law is a nurse, and she just got the vaccine, so we can see the light at the end of the tunnel. We need to continue to make personal sacrifices for the safety and health of ourselves, our loved ones, and our community. And again, continue to remain vigilant. Our number one priority remains keeping everyone in our community safe. Please continue to stay home, practice physical distancing, and follow the public health guidelines. And everyone, happy holidays.
Good afternoon. My name is Fletch Tove. I'm the Buncombe County Public Health Emergency Preparedness Director. I want to discuss and review the changes that Chairman Newman and Mayor Asheimer laid out in our new declaration, which will go into effect January 2nd and will remain into effect until further notice. Again, we're trying to focus on community transmission, and these two exceptions are intended to focus on areas where we know people aren't necessarily always wearing their masks. Other than these two notable exceptions, we will continue to align with the Governor Cooper's executive orders. The first notable change is for restaurants, breweries, wineries, and distilleries. These businesses shall limit the number of guests in the restaurant to 30% of stated fire capacity. This is a reduction from the previous capacity allowance of 50%. The second notable change is in the local mass gathering guidance. Mass gathering limitations are now reduced to 2 people for indoor gatherings. Outdoor gatherings are still set to 50 persons. Any industry or sector that has a specific gathering limitation already defined, such as retail or event spaces, will still follow that specific guidance. This new 2-person limit is for social gatherings that may happen outside of those defined sectors, such as gatherings at the home or gatherings in a public space. Apart from these 2 changes, Buncombe County will remain in alignment with Governor Cooper's latest executive orders. I do want to remind everyone that although this local declaration goes into effect January 2nd, the new 10 p.m. curfew will still be in effect through New Year's Eve, and everybody needs to take those into their planning considerations and to critically think of the impacts of their decisions over the holidays, not just on their immediate friends and family, but of the greater Buncombe County family. Vaccines are here, and with them, we enter a pivotal moment in our fight against COVID-19. But we still have many, many months before we have enough of the population vaccinated to start changing the trajectories of our critical metrics. We are still concerned with the possibility of overwhelming our local healthcare systems, and it takes all of us working together, continuing to follow public health guidance to ensure that that doesn't happen. Thank you.
Thank you for tuning in to today's community update. To learn more about COVID-19 in Buncombe County, visit our website at buncombeready.org. Thank you for your continued vigilance and dedication to the health of your friends, families, and communities, and have a safe and happy holiday season.